Okay, so winning at insurance, video number 2. This video is about what do you need to do before you can even fathom beginning this process of taking on your insurance company. And this does not matter what it is that you've decided that you're going to challenge them on. It could be anything from a medication to even if you decide to go all the way with stem cell procedures. These are the things that you're going to have prepared before you even begin. So the first thing that you're going to need for sure is a supportive doctor who's an expert in the area that you're working on. So if that happens to be regenerative medicine, for example, prolotherapy, platelet-rich plasma, whatever it is, that's the doctor that you're going to need. And it's going to have to be a doctor who's willing to take on this fight with you. And I'll have a comment about that below. So we're not going to just stop there. You can't walk into the doctor's office and expect them to say yes on the first day. In fact, these very doctors may very well be the ones who are going to say to you, insurance never covers this. Be prepared, be ready for them to say that. That's very, very common. What you have to realize about these doctors is that writing in for an experimental procedure for them is an incredibly thankless job when they're doing a service that by and large a lot of people are willing to pay out of pocket to get, when a lot of them are struggling to keep a roof over their head, and when the work that they do on your case to get these prior authorizations covered, they're not going to get 1 cent in return for all of the energy that they put into it. So that's something that you need to keep in mind when you're asking them to support you on this. They're going to have to be saintly to put that kind of energy into it on the one hand, or you're going to do the thing that I'm going to recommend to help them be more saintly about it. And I'm using saintly very tongue-in-cheek. No offense intended to anyone. But you do need a supportive doctor. Without a doctor willing to write in and say, this person needs this drug, procedure, whatever the thing is, and without them willing to write a really amazing, compelling case about your history, where you are now, and why this will help you, you might as well not even try. You're going to need that doctor on your side, and 100% on your side, willing to put themselves on the line to be able to say this. And there are several ways to get them on your side, and we'll go over that in just a moment. But that's absolutely necessary, and without that, this is just something that you cannot do on your own. But there are lots of ways to get that doctor on your side and to win them over. The other thing that you're definitely going to need, number 2 here, is you're going to have to, whether you like it or not, you're going to have either completed every other type of conventional medicine around that is necessary for the condition that you have, or at least that the insurance company has in their formulary that is considered necessary for your condition. And you'll have to have given them all a good faith effort, and you will either have to have failed all of them or not shown significant progress in all of them in order to justify going to the next step or taking on some kind of new experimental procedure. And that's something where a lot of people, they really like regenerative medicine. It's a shortcut. A lot of times it's less painful, and there are a lot fewer side effects than there are with a lot of today's conventional medicine. However, if you're not going to do something that is part of conventional medicine, then you're going to have a really good reason why you haven't done it. And I'm not saying that that's not impossible either. There are times, for example, recently I just got a great genetic panel back, and I found out that there's a whole slew of medications that I'm not supposed to take, one of them being non-steroid anti-inflammatory drugs. And now I have that as evidence that I can give to my insurance company, and when they're telling me that that's the treatment that I should be seeking for my condition, even though I don't want to do it anyway and I find them to be harmful, now I have genetic evidence to bring back to them to say, hey, look, I can't take these. Steroids, there is research saying that steroids can be quite harmful to soft tissues, and if you're diagnosed with a condition like Ehlers-Danlos syndrome, you may be able to have a doctor help make the case for them to not give you steroids. If you have gotten steroids and had difficulty with them in the past, then of course you can use that. And then, then of course there's surgery. Another thing that I will caution about surgery is that once you have that done, it cannot be undone. So I would say that surgery is the one exception to the rule. It's okay if you have had it done, but if you haven't had it done yet, I would say that's the one spot where you really want to pause and take a break before you try that for conventional medicine, because they don't always have great studies on them. They don't have great outcomes, and that's where you want to pause and really bring this to your insurance company. But what you do want to have, which would be your step 3, is, if it is relevant to your condition, a willingness to go and have a relevant surgical consult, and a willingness to be open to the surgeon in listening to what their recommendations are for the surgery, and let all of those things be put in your records and have those all tracked, that you've gone to the surgeon, that you've gotten their recommendations, and so that you know what those recommendations are. And in the end, I'm not sure that it matters what those recommendations are, because I have had everything happen from surgeons saying, we can do this $40,000 surgery and we think it'll correct, we have a 40% chance of correcting this person's pain. And I've had surgeons say, this patient now is at such high risk due to all of their genetic conditions that we will not do a surgery for this person anymore, and we don't recommend any surgeon do a surgery for this condition anymore. And so we are recommending that they only do regenerative medicine, which appears to be the only safe thing for them. So this is what our recommendation is no surgery for this patient. And I have succeeded with both of those recommendations. So I'm not sure that it matters what the final outcome is of those recommendations, but having a surgeon either write that there's a surgery that you can have, or write that you can't have surgery, I think that either one of those can provide, again, we'll come back to the word leverage later, of reasons for you to be able to get what you're looking for in the future. So be open to the surgical consult. And then before you get started, ask around in your local community about who is most helpful when it comes to access to healthcare. And I'm not talking about doctors here, although specialists are great. Ask about things like centers for independent living, which are primarily for people with disabilities if you're starting to have a lot of challenges. Ask about health access organizations. A lot of times there will be free legal help when you're having difficulty accessing appropriate health care. Ask about aging and disability research centers, different insurance advocacy organizations, patient advocacy organizations. Some states have amazing patient advocacy organizations, especially for like rare and invisible disabilities and things like that. And then if one of them has some kind of attorney-based or pro bono service, then it's nice to get connected to them, because if and when you ever need to get a little bit further on in your process, you're already set up for that. And so those are all things that I recommend preparing before you even get started. Now, gathering research. Now, keep in mind this isn't going to be the linchpin of your protocol, and you can use anything that we have gathered for you, but you're going to want to gather some research on the efficacy of what the procedure is, or the medication, or whatever it is that you're getting. And you're going to want to gather as much of it as you can, and you're going to want as many of the original articles as you can. The more the better. You are going to want as much research as you can on the things that you've already tried and failed, if you can get it. So if you have a specific condition, like I mentioned in the past, Ehlers-Danlos syndrome, there's a lot of research about how people with Ehlers-Danlos syndrome really need to be careful with chiropractic care. And so that is helpful research to have when they want to recommend that I do those things instead. There's research on the efficacy of medications and how well people metabolize medications. All of those kinds of things can be relevant. So if you take all of the things that you've already done and you can gather as much research as possible on those things, particularly things that are showing what you've tried that has failed, and that could help explain why it's failed, and why what you're seeking to do may be helpful for you, that would be great. And then the last and most important piece of all is to, and this is how to get your doctor on board, help your doctor help you. Do the whole Jerry Maguire help me help you thing. That may be a dated reference, but your doctor likely is not going to have the energy or the time to gather your entire medical history. So you need to write down your medical history, your relevant medical history to what it is that you need treated. So if you have a bad ankle, you need to write your entire bad ankle history. If you have Ehlers-Danlos syndrome, I'm sorry that it's going to be a nightmare, but you need to write down all of your injury history, all of the procedures that you've had, everything that's failed, all of the injuries, just everything. And the reason that you need to do this is that you're going to have a better handle on it in a narrative than your doctor will. If your doctor tries to sift through your records, it's going to take them so much longer than it'll take you to say, oh yeah, I remember I broke my ankle this year, and then I broke my other ankle, and then I fell and I tore my back. And you might have to go through your own records too to try and remind yourself of when all your hospitalizations are and to get the dates right and to do all of that stuff. Don't worry if your medical terminology isn't perfect. That's fine. None of us are going to be. But if you can even write it out in layman's terms, then that gives your doctor something to start from. And it makes his or her job much easier in terms of really being able to put things down in a collective narrative. And you can even run it by people and ask them, does this all make sense? Are there better ways that I can word some of these things? And then when you bring it to your doctor, if it's coherent and linear and your doctor doesn't have to do the work, your doctor is going to love you for that. And is going to say, oh, well, this is a lot easier for me to do than going through 20 years of your records and your injuries and trying to make a case to your insurance. I can clean this up and I can do this pretty quickly and we can send out a letter. And so by doing those things, you help your doctor get on your side. And by offering to do those things, you help your doctor get on your side. And you make that fight not so daunting for your doctor. And if you can do that, then they will be on your side. And you can really help them get started. Now that we have all of that in place, the next video is going to be, what do you actually do if you have the prerequisites to start to launch this huge process? So that's coming up next.